Um, Also, there is a great need for insurance coverage for family members. It's very stressful when a family goes through an eating disorder. Trying to support the eating disordered individual is very difficult. And it creates all kinds of tensions and problems and resentments. But currently, only the eating disordered person is covered. Very, very minimal coverage is given for family therapy and those kinds of things. But it's beneficial to have that kind of coverage for family members, because if you have that, the family members are in a better mental state to deal with the disorder because they have a way to vent. They have a way to discuss what is going on with the eating disordered individual with somebody who is trained and who understands the disorders. So this requires a real lobbying for a change in how insurance companies work in terms of coverage. Related to who should be in treatment and the type of treatment to utilize, there are benefits to both individual and group therapy. With individual therapy, it's very private. Things that you wouldn't feel comfortable revealing to a group, you can reveal to one person. It's very intimate, and so there are good benefits to that. You have confidentiality that you know won't be breached because of doctor-patient privilege. However, in a group, you have more people who understand what you're going through. You have people that you can go to in terms of a support system. A lot of times, your therapist may or may not have had a disorder themselves, so the level of understanding might not be there from your therapist that you can get from a group. So the point being that there's good and bad things about both types of therapy. The individualized therapy is very good in that, again, it's more private, and the group, you get that feeling of empathy. So it's recommended that you don't focus on one type of therapy. You make an adjustment based on what the individual needs, what they feel comfortable doing with. Use a little bit of both. Don't isolate yourself within a group, where you just feel down all the time because that's all you're talking about is the negative things, and choose a well-moderated group if you do go in that direction, or whatever, group that you have. Also, there's a need to educate the public about the therapy. The research that I did and a couple of other literature sources indicated very strongly that when people go into therapy, their ideas about therapy are based on popularized accounts in the media or other literature. And so they don't really have an understanding of what the therapist is going to do, why the therapist does what they do. Because the public isn't informed. The therapists are not telling them this is how we go through therapy. This is the rationality behind this, and this is our goal. They aren't told that when they go into therapy or prior to going in. Within therapy, it is recommended that patients try to stay within a present tense. It's my belief that therapy focuses too strongly on past events. That does not recognize the fact that the reason, why you have or why you engage in disordered eating can shift from time to time. The reason why you, had disordered eating 3 years ago isn't the same reason why you're continuing that behavior now. Our rationale and our needs in terms of why we utilize the same coping mechanism are very different. So you have to stay in I feel because, that kind of language. Within that idea, it is also recommended that the idea of the inner child be done away with. That is another concept based in past-oriented beliefs and therapy that is, I feel, very negative, because whether or not therapists like to admit it, going to the inner child requires a return to the inner child, which implies that you are already an adult, or that you have adult rationalities or capabilities of rationalization. The inner child idea, while it is good in some aspects, it creates an unnecessary separation, because you can say, well, my inner child felt or experienced or what have you. You know, you draw pictures of the inner child or what have you. And it stops you from staying in that present tense and saying, I feel at this moment because of what happened this particular way. It stops you from taking responsibility and really owning the events and the feelings that you're having. So I would like to see that idea eliminated from therapy very much.